2019, former President Trump signed an executive order meant to provide transparency in health care. Ileana Capian joins us live from the newsroom. Ileana, have any hospitals in our area put that order in effect?
Well, Paige, this new federal rule went into effect at the beginning of this year, and while the name Price Transparency Act may allude to more clarity of medical pricing, that just may not be the case.
Hospitals were required to provide patients with information on the cost of various procedures, and what they required hospitals to report was not necessarily the cost of procedure, but we are required to provide the public with what our contracted rates are for all the various insurance companies.
The mandate required every hospital to put a link on their website with a pricing grid. Unfortunately, the prices are listed by hospital billing codes, which most people are unfamiliar with. Johnson says for the general public, this means that this information may not be really useful because every insurance carrier has different contracts.
You need to, number one and foremost, contact your insurance company and find out, one, is it covered? Two, what is your deductible and what is your copay? And that is your out-of-pocket expense. The contracted rates that hospitals negotiate with the large insurance companies across the country really does nothing in providing information for the patients as far as what a procedure will cost.
One important thing to remember is the price the hospitals will provide individuals are just estimates. There are variables that could change the total cost of hospital care.
The cost is going to depend on the status of your insurance, any changes in your insurance, how long were you in the hospital, did the doctor order additional tests that were required to help treat you while in the hospital that were unforeseen, and what kind of costs were affiliated with your recovery that were unforeseen. So any information that you get prior to going and having a procedure is just that, it's an estimate.
As the Price Transparency Act goes, Johnson says he thinks the stance of the Alabama Hospital Association is that there's just a lot of confusion surrounding the information the hospitals were forced to put out.
I think in its current state, it's going to prove to be more confusing for the general public than it is beneficial.
And for those individuals who do not have health insurance, they are encouraged to call the hospital ahead of time and set up an appointment with a patient representative who will help work out the estimate of care and, if needed, work out a plan for payment.